Hello, everyone. Thank you for joining us today for our webinar entitled Risk Analysis and Risk Management Beyond Meaningful Use. Today's presenter is Andy Petrovich, Altern's Health IT Security and Risk Analyst. My name is Liz Jones, and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. We will be keeping everyone muted during today's presentation. If you have a question, please type it into the questions box in your GoToWebinar interface, and we will address it during the Q&A. Because of the large number of attendees for today's webinar, we may not have time to answer all of the questions. If we do not address yours during the broadcast, you will receive an answer through email. Also, a link to a copy of today's slides and the recording of this presentation will be available soon on the webinars page of our website at www.mceda.org/webinars. Today, Andy will review important information about security issues facing healthcare providers today, including security risk analysis, risk management, compliance requirements, and more. Following the presentation, with any time remaining, Andy will answer any questions posed by the attendees. Please note, the information you will hear in this broadcast is current as of today and is only intended to be a general summary. With that, I will turn things over to Andy.
Thank you, Liz. And thank you all for joining. Today, we're going to talk about security risk analysis. In this presentation, I'll provide answers to the questions listed on this slide. But please keep in mind, this is not legal advice and is intended as an informative resource. First, we will discuss what do we mean by security, specifically information security. Why continue to do security risk analysis after the EHR incentive program ends? What is required? What do you need to do a security risk analysis? What do you need to do after identifying risk? And where can you get help with risk analysis? We'll start with establishing a common understanding of what security is. Using a description provided in the Security 101 educational paper, linked at the end of this presentation, security is not a one-time project, but rather an ongoing dynamic process that will create new challenges as covered entities, organizations, and technologies change. Security is preparing, responding to, and addressing potential threats. Security is awareness and mitigation of vulnerabilities within your systems. Security enables and ensures the proper access and use of information systems and sensitive information. Security protects your patients, your reputation, and your bottom line. Security is an investment in your organization. Security is not compliance. Now there is overlap, and that is, security helps you comply with security requirements, and compliance with those requirements can help you be more secure, but they are not the same. And perhaps the simplest illustration of this is to consider that you can be compliant with security requirements and still have a data breach. I will elaborate on each of these points throughout the presentation. Moving on, why continue to do security risk analysis as the use, or that is to say, the EHR incentive program ends? For one thing, protecting the confidentiality, integrity, and availability of your critical data is good for your bottom line. Securing your data protects its value. When it comes to patient data, consider how you would make clinical decisions based on information in a patient's medical record if there was no control over who could access or modify it, or if your access to the information were taken away. Protecting this information is critical to healthcare provision. And to touch on what I mean by confidentiality, integrity, and availability, I'll provide some definitions here. Confidentiality means preserving authorized restrictions on information access and disclosure, including means for protecting personal privacy and proprietary information. Confidentiality refers to that the privacy aspect that is so often the focus of what we think about when it comes to HIPAA, privacy, security, and breach rules. Integrity means guarding against improper information modification or destruction, and ensuring information non-repudiation and authenticity. Basically, integrity is the ability to trust that the information you have is accurate and has not been modified or corrupted. And availability means ensuring timely and reliable access to and use of information. All of these dimensions are critical to security, and risk potentially compromises any of these three dimensions. Risk is constantly changing and demands ongoing vigilance. What is secure at one point in time may not be secure later on. Changes to how your organization uses patient information, such as through different computer systems, software, or platforms, changes risk. New threats are always emerging, and the following links provided on this slide are to stories showing real-world impact of risk. Cyber attacks can shut down providers' access to medical records for days at a time, including there's a recent cyber attack against Southern Ohio Medical Center, which has shut down their EHR access for days. And a few years ago, there was an EHR vendor that was hit with ransomware. This was a cloud-based platform, and many providers were locked out of accessing their EHR system for, in some cases, 6 days. So almost a week of having no access to your patient data. Also, the number of healthcare records breached is on the rise. We saw a 51% increase in the number of records breached from 2019 to 2020. And ransomware, which you may have heard of, is a booming criminal enterprise and can cost the victims hundreds of thousands of dollars or more just for the ransomware payment. It's not even considering other related costs, such as disruption to billable services, response, disruption of the computer systems, legal fees. And those ransomware payments increased 333% from 2019 to 2020. So all of these reasons points to the importance of updating your security risk analysis and maintaining a current and accurate understanding of the risk facing your organization, because the impacts are real. Security is an investment. We often think of the cost of HIPAA breaches as being lump sums per medical records, but other costs, such as operating and administrative costs, loss of revenue, costs related to investigation and incident response, legal fees, and others really add up. A recent study found that the average cost of a healthcare data breach in the United States to be over $9 million. By maintaining usability and accessibility of clinical data, security protects your bottom line and also promotes patient safety and care quality. There are other reasons to continue to do security risk analysis. For one, it's required by HIPAA. It's also required by MIPS or QPP and other programs. With the ongoing rise of health data breaches and criminal attacks targeting health information, security's profile is rising. These requirements aren't going away. But when it comes to compliance, keep in mind that compliance represents the minimum standard. Compliance is a floor, not the ceiling of performance. Compliance isn't going to thwart a cyber criminal who is trying to figure out novel and unexpected ways to infiltrate your systems. To really be secure, you have to go above and beyond compliance requirements. That being said, compliance is important. So let's look at what is required. The HIPAA security rule requirement is shown here, which states covered entities, and that is any entity covered under HIPAA, such as healthcare providers, group practices, and the like, must conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information held by the covered entity or business associate. Business associates also are required to do risk analysis, notably. And I will also provide a definition of electronic protected health information, which refers to protected health information, and that means individually identifiable health information that is transmitted by electronic media, maintained in electronic media, or transmitted or maintained in any other form of media. And protected health information notably excludes individually identifiable health information such as what might be found in education records under FERPA, in employment records, and regarding a person who's been deceased for more than 50 years. So electronic protected health information is referring to protected health information, or PHI, specifically that is transmitted over the electronic media. And what is defined as electronic media is electronic storage material on which data is or may be recorded electronically, including, for example, devices in computers, such as hard drives or other storage units, and any removable or transportable digital memory, such as a magnetic tape or disk, optical disk, or a memory card. And then transmission media is used to exchange information already in electronic storage media, which would include, for example, the internet, extranet or intranet, leased lines, dial-up lines, private networks, and physical movement of removable, transportable electronic storage media. Now, certain transmissions, including paper, via facsimile, and a voice over telephone are not considered to be transmission via electronic media if the information exchanged did not exist in electronic form immediately before the transmission. So information that's transmitted over a telehealth platform may not be considered ePHI, but it is still considered PHI. It is protected under HIPAA, under the privacy rules. The same standard, this HIPAA requirement, is referenced in the promoting interoperability requirements. For meaningful use and QPP, there are additional requirements involving the timing of the SRA. Also, the HIPAA standards for encryption and addressable specifications are invoked. Specific to timing, a unique SRA must be done for each performance period. It must be done during the calendar year to include the entire performance period, and updates must be conducted as necessary with identified risks being addressed as part of your risk management process. If you fail to meet these requirements, you can face substantial monetary penalties following an audit or investigation, including potentially having to return your incentive payments and other costs. Before going further, let's take a moment to address a frequently asked question. Do I need to contract with a third party to do my SRA? No, you don't need a third party to do the SRA, but many benefit from and prefer expert assistance. I have a cloud-based EHR. Do I need to do an SRA? Yes. This was established under the Omnibus Rule in 2013. Having a cloud-based EHR, they are considered business associates, and you also need to make sure that you're including any devices used to access that cloud-based systems within your risk analysis. So even though you can't control their servers and their cloud-based environment, you do need to understand the risk facing how you're accessing that data. Is there a specific risk analysis method I must follow? The answer is no, but any method should conform to the OCR guidance on risk analysis. We will review that guidance later in this presentation and link to the document. But a checklist is not enough, but there's no specific method that you have to follow exactly. Does the risk analysis need to look at EPHI housed outside the EHR system? The answer is yes. While the EHR likely houses most of your EPHI, you do need to look at any system that creates, receives, maintains, or transmits EPHI. So even if it's not being stored in a different system, again, any system that's used to access that information needs to be considered in your risk analysis. Do I have to address all risks prior to testing for promoting interoperability? The answer is no, but you should have at least a plan in place that outlines how you will address those risks conforming to your risk management process. And finally, do small medical clinics still need to do a risk analysis? The answer is yes, because you're covered entities. Two more points to consider regarding compliance. During random audits conducted by the Department of Health and Human Services Office for Civil Rights, or OCR, who is tasked with enforcing HIPAA, it was found that most covered entities and business associates did not meet the SRA requirement. As a result, the HHS website provides a wealth of information and clarification on these requirements. Also, a bill signed into law earlier this year, HR 7898, amends the HITECH Act to incentivize the adoption of recognized security practices, namely the Health Industry Cybersecurity Practices, promulgated under the 405D work group and released in 2019, and the NIST Cybersecurity Framework. Links to these will be provided at the end of the presentation today. Now, adoption of these practices will help strengthen your security program if implemented effectively, and also, thanks to this law, should mitigate the impact of compliance deficiencies identified in HIPAA audits or following a breach. And that being said, the law gives OCR a lot of leeway in terms of how they choose to implement it. OCR is not obligated to reduce penalties or reduce corrective actions required following a data breach or deficiency, but it is encouraged, and the law does provide an incentive for adoption. However, under no circumstances would adoption of these frameworks let you off the hook for the SRA requirement or other HIPAA requirements. Now that we've reviewed external requirements, let's consider what your organization needs internally to do a risk analysis. Fundamentally, you need to understand your environment. What computer systems are accessible on which devices? Where is patient data being stored? Where is patient data being transmitted and used? How could these access points potentially be compromised? You need to understand risks and vulnerabilities to evaluate them, which means you need to understand how your systems work and how the information is being shared and flows between them within your systems and also your workflows as a practice. So that understanding is required also to implement reasonable and appropriate safeguards. Like everything else, when it comes to an SRA, you get out what you put into it. You need to take the time to understand, investigate, and see where your threats and vulnerabilities are. And I emphasize time because it does take time. It takes time not only to look at your systems internally, but also to understand where those threats and vulnerabilities may be within the context of trends in information security in general. The scope of your SRA must be inclusive. All devices which create, receive, maintain, or transmit patient information must be included. You have to look beyond your EHR system. You have to look at the devices on your internal network, even if you have a very simple, flat network. Those devices, the endpoints, your network devices, and so on, all need to be included because they are all at risk. As I said before, the OCR provides guidance on risk analysis, and we'll review these steps, which are summarized here in the following slides. We'll touch on each of these elements, but I encourage you to review this guidance in full, carefully, to assist in performing an accurate and thorough SRA. And the first element listed here is to have a comprehensive scope, and like I was saying, that means all EPHI within your organization needs to be included. Identify and document potential threats and vulnerabilities, assess current security measures, determine likelihood of threat occurrence, determine impact of threat occurrence, determine the level of risk, finalize your documentation, and then perform ongoing periodic review and updates of your risk analysis. So let's dive into each of these steps. Step one, identify and document your assets to attain that comprehensive scope. That means all systems that create, receive, maintain, or transmit EPHI. And I've repeated myself on that a few times because it's really important and is often overlooked. An organization's risk analysis needs to take into account all of its EPHI, regardless of the particular electronic medium in which it is created, received, maintained, or transmitted, or the source or location of its EPHI. That means you have to know where the EPHI in your organization resides. You can gather relevant data by reviewing past and or existing projects, performing interviews, reviewing existing documentation, or using other data gathering techniques. And then the data gathered on EPHI using these methods must be documented. Consider all your devices. And I listed here, like I said, more than just your EHR. Consider shared folders within your internal network or cloud-based system. Consider if you have a separate billing system from your EHR, or if you have a separate practice management system. Do you have any cloud-based services that you're using, such as a shared calendar, or email, or other transmission platforms that could be transmitting patients' identifiable health information? Consider also computer hard drives, portable media such as USB drives, CD-ROMs, SD cards, and also any such media that may correspond to the use of a medical device. You may have a computer console hooked up to a medical device. The medical device may export to portable media, and that data needs to be included as well as any information that's on the medical device itself. And you should also consider external sources, such as your business associates, and whether or not they have any assets you need to consider that are within your workspace. And so beyond the devices, you want to gather information on devices used to access your systems and include them in your SRA. But you also need to consider the EHR and other applications, like I was saying. And consider also that EPHI is broader than your medical records. Your medical records obviously contain a lot of EPHI. You can have individual files like PDFs, spreadsheets, or other sources sitting on a computer or a storage device somewhere. And if those are compromised, that could result in a breach. So again, to have that comprehensive understanding, you really need to consider all of these different sources. How are they accessed? Where are they stored? Who has access to the devices? So this information about the devices themselves and how they're used is all critical to having an accurate and thorough risk analysis process. The next element is to identify and document reasonably anticipated threats and vulnerabilities. You must identify and document reasonably anticipated threats to EPHI. You must also identify and document vulnerabilities which, if triggered or exploited by a threat, would create a risk of inappropriate access to or disclosure of EPHI. A threat is any circumstance or event with the potential to adversely impact organizational operations, assets, individuals, or other organizations through an information system via unauthorized access, destruction, disclosure, or modification of information and/or denial of service. Threats can be internal, such as a member of your workforce acting beyond the scope of their authority, or external, such as a cyber criminal trying to breach your computer systems. Threats can also come from malicious or benign sources. As an example, a common internal threat stems from trusted insiders simply making mistakes. Vulnerabilities are system characteristics which can be exploited by threats to impact your information systems. These can vary in severity. Plenty of vulnerabilities can be found within your environment, but you should also consider how remotely based systems are vulnerable. For example, how could a characteristic in the authentication process for a cloud-based system lead to a possible breach of that system? Assessing current security measures or safeguards is the next element. What do you currently have in place to protect patients' information? You should assess and document the security measures used to safeguard EPHI, whether security measures required by the security rule are already in place, and if current security measures are configured and used properly. These safeguards can be categorized as administrative, physical, and technical in nature. Examples of each category are listed under the bullets, and this corresponds to how the HIPAA security rule looks at safeguards in the requirements. You can find more details on each of these categories and examples in the HHS HIPAA security rule educational paper series that is linked here and will also be linked at the end of this presentation. Security safeguards are not one size fits all. The goal is to have appropriate safeguards in place that allow permitted access while preventing unauthorized access. But for this step in the SRA, you are not trying to improve your safeguards as you go. You are just identifying and documenting what is currently in place. Improving safeguards should come after the assessment is complete. And this is important. If you take the approach of fixing your safeguards as you go through the risk analysis, it will take much longer and you may never finish. The next step is to determine the likelihood of a threat occurring. Likelihood is defined as the probability that a given threat is capable of exploiting a given vulnerability or a set of vulnerabilities. That is to say, likelihood represents the chance of a potentially adverse event. How likely is a given threat occurrence? How likely is it that a given threat yields an impact? You can think of likelihood quantitatively or qualitatively. And the tables to the right show how you might consider this. It is subjectively determined, so there's no exact way that you have to consider or record vulnerability. And the tables that are listed are from the NIST Special Publication 800-30, Revision 1, the Guide to Conducting Risk Assessments. Again, that is linked at the end of this presentation, and I encourage you to review it. You may find the body of the text to be a bit dry, but it provides a thorough and detailed explanation of the risk assessment process, and the tables and appendices at the end of the document are very helpful tools. And you'll see we'll refer to this document again in the coming slides. So your security controls can reduce the likelihood of a threat occurrence or the likelihood of a threat being successful. Either way, your risk mitigation strategy should reflect your assumptions that are documented in your risk analysis about the likelihood of a threat occurring. The next step is to determine the potential impact of a threat occurring. The impact of a threat event is the last piece to consider before you determine risk. Depending on the vulnerability and the systems affected, impacts can vary considerably in terms of their severity. Would a ransomware infection shut down your entire business? Has a short-term power outage created a minor inconvenience in accessing your computers? Two examples of an event leading to an impact. An impact can totally disable your systems and prevent any operations for sustained periods of time. Recall I mentioned the news stories about EHR systems being inaccessible for days on end. An impact could also be all of your patient records breached. These would be very severe examples of impact. But impact can also be short-term disruption to operations, such as a brief loss of electrical power or internet access. Or you may have a smaller breach of patient data, such as one patient record or even a partial patient record breached. Now, these are less severe than the previous example, but are still significant. So consider how threats and vulnerabilities might affect your organization and determine the impact accordingly. And again, you'll see there's a table there that provides an outline of how you might consider or categorize different levels of impact. Again, there is a lot of subjectivity here. So you do want to make sure you're documenting all your steps and your thoughts in the risk analysis. Now we finally get to determine risk. Risk is determined based on the combined likelihood and impact of an adverse outcome stemming from a threat successfully exploiting a vulnerability that affects one or more of your assets. It is the combination of likelihood and impact affecting your environment that's how you determine risk. So you can see in the tables on the right, you have the likelihood on the left-hand axis and the level of impact on the right-hand axis, and how those different qualitative variables intersect to result in a risk determination of very low, low, moderate, high, or potentially very high. And then the second lower table provides a way to interpret what those qualitative values can mean in a more narrative context on the right-hand column. But you need to consider risk inclusively as being to organizational operations, assets, individuals, or other organizations due to the potential for unauthorized access, use, disclosure, disruption, modification, or destruction of information and or information systems. All the prior steps lead up to this point. So it is important, critically important, that each of the inputs determining risk are accurate and thorough. Step 7 is to finalize your documentation. The security rule requires the risk analysis to be documented, but does not require a specific format. The risk analysis documentation is a direct input into the risk management process. Consider also that other programs may have different requirements for documentation. An auditor reviewing your promoting interoperability score may want to see different things than an auditor looking for at HIPAA compliance or investigating a breach. Additionally, you may be working with other agencies, such as a quality improvement organization, a CO, insurance companies that may want to see additional documentation. Without documentation, you're going to have a hard time demonstrating compliance with any of these requirements. So make sure your documentation is thorough, including personnel roles and functions, your risk analysis methods and results, policies and procedures, and how the risk analysis findings are incorporated into your practice. Beyond compliance requirements, consider how this documentation and what documentation will be useful to your organization. You may find it hard to communicate your security expectations clearly to personnel without documentation. You may also find that documentation helps you remember important details in the future. Documentation helps you maintain consistency in your organization across people and over time, for the same reason that documentation helps you with compliance, and that is that your methods and expectations are clearly identified and defined. The final element is to periodically review and update your security risk analysis. The security rule does not specify how frequently to perform a risk analysis as part of a comprehensive risk management process, although there is a more specific frequency requirement for promoting interoperability. The risk analysis process should be ongoing. This continued process is referred to as risk management. So how can that be done? Risk management is defined as the program and supporting processes to manage information security risk to organizational operations, assets, individuals, or other organizations, and includes 1, establishing the context for risk-related activities or framing. 2, assessing risk. 3, responding to risk once determined. And 4, monitoring risk over time. As outlined in this graphic here, which is taken from the NIST Special Publication 800-39, Managing Information Security Risk. And while the arrows in this diagram point in both directions, it may help you to consider risk management as being cyclical. You can use the insight gained from your security risk analysis to inform your policies, procedures, and other security controls. Consider your risk analysis results as a living document. So while there is a cyclical nature to this, similar to PDSA or Plan, Do, Study, Act, you can also have recursive feedback loops within your system and update continuously with new information. So monitoring, responding, assessing, and framing can all be mutually informing and updated with new information as it arrives from, for example, security incidents that you may identify as part of your incident response or are brought to your attention through potential business associates or other actors, or other observations in your ongoing monitoring. For example, monitoring of user activity in your systems. Consider how you will maintain ongoing awareness of security and risk. Monitoring is key to this, defined as maintaining ongoing awareness of your organization's risk environment, risk management program, and associated activities to support risk decisions. Like I said, that's a critical part of risk management. The SRA establishes a baseline of awareness, and the ongoing risk management maintains and updates that awareness. One way to think of it is the SRA, with all the data gathering, documentation required, does reflect sort of a snapshot in time. But how will your organization maintain ongoing awareness? That is risk management. So ask yourself these questions to create a risk management process. Do you have a risk management team or committee? If so, how often do they meet and who is involved? What areas are top priority for your security monitoring and improvement? What risks have you identified that are most severe? What can you do to improve realistically, given potential time and resource constraints facing your practice? When will you conduct your next SRA? What might cause you to update your SRA more frequently than expected, such as due to a change in technology used, change in ownership, turnover in key staff or management, or a significant security incident? Note that MIPS requires a unique SRA for each year of participation. And again, like I said, other agencies or programs, including state governments, ACOs, et cetera, may have additional requirements. In addition to your risk analysis documentation, your risk management process must also be documented. This list is what OCR asked of covered entities during their random audits, which includes documentation of security measures, efforts to manage risks previously identified, policies and procedures, current and ongoing risks reviewed and updated, and evidence that prior year's documentation is periodically reviewed and updated as needed. Keep in mind, all documentation for HIPAA security requirements should be kept for a minimum of 6 years, since the OCR can request such documentation from up to 6 years prior in the course of their audits and investigations. This documentation is how you demonstrate the security and compliance efforts that you are doing. So make sure you put yourself in a position to get credit for your hard work by maintaining thorough and accurate documentation. Once you've identified risk, now what? The next step is to start planning your response. How you do this is really up to you, but be sure to document it as part of your risk management process. Remember, promoting interoperability requires and calls out that you address risks according to your risk management process. Consider how your organization will respond to and mitigate risk. Risk mitigation is defined as prioritizing, evaluating, and implementing the appropriate risk-reducing controls, countermeasures recommended from the risk management process. And risk response is defined more broadly as accepting, avoiding, mitigating, sharing, or transferring risk to organizational operations, organizational assets, individuals, and other organizations. So as you can see, you have a lot of options when it comes to how you choose to address risk. That being said, you do not want to simply neglect to address a risk in some manner, because it is required that you have at least a plan to address the risk. You can set yourself up to succeed by prioritizing the risks identified according to several variables, such as likelihood of occurrence, immediate or future impact, limits to your organization's resources, and other factors as relevant. You can set goals for addressing risk in a reasonable time frame and create a plan of action for each. Again, the expectation is not that risks will all be identified or risks will all be addressed as they're identified, but you do want to create an action plan to address those risks in a reasonable time frame. Once you prioritize areas to address, the information used in your risk analysis can guide the implementation of security controls, inform policies and procedures, improve physical security, and deploy technical controls. Make sure to address these items and update your risk management process as needed. Here are two examples of addressing risk. first, let's consider an unencrypted laptop. In the course of your risk analysis, you found that some laptop workstations were storing ePHI. Not entire medical records, but some identifiable health information on a portion of your patients was being stored in these hard drives. The risk is, if this information is accessed by someone who steals the laptop, or if the laptop is simply lost, you would have a potential breach to deal with and could incur major costs. So one way to address this risk would be to encrypt the hard drives on your laptop. By doing so, you reduce the risk to your organization and the persons whose data is represented on those hard drives by making that data inaccessible. So, even in the likelihood that the laptop is stolen, the impact is dramatically reduced as long as the hard drive was encrypted, because one, the patient's information is not accessible, and two, it is therefore not considered a HIPAA breach. The loss of the asset still has a cost, but you would avoid the most catastrophic impact of the device being stolen or lost by securing the data within it. Another example is the risk presented by weak passwords. You can control some variables of the passwords, for example, by requiring a minimum length and complexity, or changing those passwords periodically, but it is harder to stop users from reusing passwords across different systems. You can encourage it or discourage it as much as you'd like, but it still happens, and it still presents a very real risk to any system in particular that could be internet accessible from outside of your organization. If your employees have basically the same password for their social media accounts or other systems as their login to your EHR or other system that's housing ePHI, there is a risk that your patient's information could be exposed if their passwords on one system are compromised and lead to unauthorized access through their login. This actually happens more often than you might think. Private companies and websites are breached with some regularity. Often, these are not publicly disclosed because most industries don't have to report these data breaches. And the result is that entire databases of stolen passwords and login information for different websites are bought and sold daily on the dark web. So if you or your employees are reusing passwords, you may not even know if one of the websites where that password's in use got hacked. And if that same password or a very similar password is in use to protect patient's information and to authenticate your access to it, you can have a very likely breach potential there. So you can mitigate this risk by deploying what's called multi-factor or two-factor authentication on your systems. This way, even if the user's password is compromised, an attacker would need the additional factor, such as the user's mobile device or biometric characteristics. It really depends on the type of multi-factor authentication and how it's configured. But essentially, an attacker would be able to steal or get access to a user's password, and they would still not be able to access the critical data that's stored within those systems. Multi-factor authentication vastly reduces the likelihood of an attacker successfully leveraging login credentials. And so these two examples that I've provided are common and issues that healthcare entities face and are really powerful safeguards. And if you deploy these to protect your systems, you will be vastly reducing your risks. If you would like to know more about security risk analysis, this list here will keep you busy. You may want to start with the items on the top left corner. In fact, I encourage it, such as by reviewing the Health Industry Cybersecurity Practices, or HICCUP. Those are very down-to-earth, practical, and specific guidance tailored including to small healthcare providers. And so it's really useful guidance And as I said before, there is an incentive to adopt those practices. You also may find signing up for the OCR security listserv to be really informative. They provide great resources, clarification on and guidance for different security requirements and how you can meet them, and also updates on enforcement actions or other time-sensitive information. You can also avail yourself of cyber hygiene services from the Cybersecurity and Infrastructure Security Agency, or CISA. And those are free to critical infrastructure entities, which includes healthcare providers in general. You can also review the HHS guidance on risk analysis, which we're doing that for the bulk of this presentation. And you can review that guidance yourself and more. There are other resources here, the CMS Security Risk Analysis Tip Sheet and the MIPS QPP Spec Sheet. Those are both tailored to the promoting interoperability requirements. The Cybersecurity Checklist that's linked is an excellent tool. The ONC has a guide to privacy and security of health information. There are a number of different HHS guidance documents and websites you can review. HHS, the internal cybersecurity awareness training that they give to their employees is available for free on the internet, so you can use that to help train your staff. You can also review the NIST documents that are listed here. Those are all quite technical in nature, but often contain really good information, really good resources. And the right-hand column contains other important resources you can use, such as the NIST Cybersecurity Framework. You can sign up for notifications from CISA. You can look at who has been breached on the OCR reported data breaches website and their audit protocol. You can look at the Australian government's Essential 8 maturity model. Excuse me. Center for Internet Security has what they call the critical security controls, which provide excellent guidance to securing your IT systems. You can also look at the 2021 cost of a data breach report from IBM and the Ponemon Institute, and the Verizon Data Breach Digest provides reviews of different case studies on data breaches that are investigated by the Verizon security team, and can be very interesting and informative reading. Do you need help with security risk analysis? If you feel that you need further help, MCEDA is available. We have performed over 1,000 SRAs at over 350 unique healthcare organizations. Give us a call or email, and we can discuss how our SRA service can meet your organization's needs. And you can also check out these new opportunities. Stay engaged with LTAR. And now, I think I'll turn it back over to Liz.
Thank you, Andy. We actually did get a few questions during your presentation. I did want to remind everybody that a link to a copy of today's slides and a recording of this presentation is going to be available soon on our website at www.mceda.org/webinars. That should be available before the end of this week. Andy, we have a question. Is encryption required for PHI data transmission via phones or fax?
That's a really good question. And if you recall, I mentioned when I was describing the definition of ePHI, there were some exceptions on the transmission piece of the electronic media where facsimile and phone are not considered ePHI unless the point of origin was electronic. So if you're taking a paper, if you're taking a piece of paper, like a printout that has some PHI on it and you're faxing it, it's not necessarily considered ePHI. So then if it's not considered EPHI, the specific security rules and standards wouldn't apply, but it is still considered PHI as long as it checks all the other boxes. And so the privacy rule requirements apply, including the privacy rule has a requirement for security, which is very broad, but basically you need to have reasonable and appropriate safeguards in place. But the specific encryption specifications and standards wouldn't necessarily apply if it's not electronic protected health information. So that's a very good question.
Can I use the free ONC SRA tool to do a security risk analysis?
Yeah, you can. That tool does provide a good framework for doing a risk analysis. There's an extensive compliance checklist and also a section on threats and vulnerabilities. But again, like I said before, when it comes to risk analysis, you get out of it what you put into it. So if you're going to use the tool, make sure you're putting, a lot of thought and effort into, answering those questions, making sure they're accurate, representative of the practice. And also, I would say that you may not want to exclusively rely on the ONC tool. It can help guide your process, but you may want to look at other resources as well as part of your risk analysis and risk management process.
Is it better to avoid doing a risk analysis than to do a risk analysis and not address the risks?
Sure. Yeah, that's a good question. Yeah, this comes up sometimes, and the quick answer is you should do the risk analysis. What you see in an enforcement actions would be that if you've done a risk analysis and have not addressed the risks at all, or you have no plan, that does not go well. So it's certainly true that if you're doing your risk analysis and you identify risks, you want to have something in place to address them to whatever extent is reasonable and appropriate. Security is never going to be perfect, but you want to show that you're not only aware of risks, but also are addressing the risks to the extent feasible. Compared to enforcement actions where there is no risk analysis at all, they tend to be worse if you don't have any. So it is better to do the risk analysis, but I would still, I don't want to encourage you to not address the risks. At least have a plan in place to mitigate and address those risks as much as possible. If you feel that the risk needs to be transferred or accepted for some period of time, document your reasoning for that. Even if you can't address the risk right away, again, as part of your plan, if there's going to be a delay, what's the reason for that? That kind of, outlining your logic and prioritization really helps in those instances, because it's not that you're going to be able to address all of the risks right away. And so it's not necessarily expected that you'll be able to address them all, but you do want to make sure that you have a plan and you can outline that with some documentation. So definitely do the risk analysis. It is critical. And beyond compliance, I'm talking about compliance here, but beyond that, you need to do the risk analysis to protect your organization in the first place. You need to understand where your risks are. And so beyond compliance, there are very practical considerations that doing the risk analysis, protecting your organization, understanding and reducing the likelihood of a breach or disruption. There's value in that, even if you're never held accountable to compliance standards.
Okay, we have one more question. Is there a standard format or documentation that I need to keep?
That's another good question. There's no specific format, but should be accurate and thorough. As much as possible, if you can leverage existing documentation. For example, if you work with an IT provider and they maintain an asset inventory, you can leverage their system, their inventory system, but you'll want to have documentation that's reflective of the point in time where you're doing the risk analysis. So if they have a catalog of the assets that they're managing the security for, get a screenshot or an export of that point in time to correspond to when you did the risk analysis. And it's also worth noting that even an IT vendor may not have a catalog or inventory of all of the devices that would be included in the scope of HIPAA requirements, such as specific medical devices, network equipment, portable electronic media, or your personal devices. If you're using your personal cell phones or computers to access a cloud-based system, for example, your IT company may not have those on their radar, so to speak. So you can leverage the existing documentation, see what's there, but also consider that it may not be totally inclusive. So you may need to add to it using your own investigations, data gathering, to make sure that you are inclusive in your scope and can show that you're considering all the different devices that could potentially be compromised and lead to risk. There isn't a specific format. It does not have to be entirely formal as you might consider it, but it needs to be accurate and thorough and show what it needs to show. It should correspond to a particular point in time when you're doing the risk analysis, and then subsequently, addressing the risks that were identified. Your documentation should tell the story, again, to help you get credit for the work that you're doing, also to make sure that you're not forgetting to address certain things because you're not writing down all the details. And then again, to make sure you have that inclusive scope. So again, no standard format that's required, but just be thorough and accurate and document the information in a way that's makes sense to you and is useful for your organization.
Okay, that is actually all the time we have for today. If we did not answer your question, we will answer it through email. And again, a copy of these slides and a recording will be available at www.mceda.org/webinars. Thank you everyone for attending and have a great day.